There is something happening inside someone's mouth right now that no one is going to warn them about until it's too late. Most people, when they have a toothache that comes and goes, treat it like a minor inconvenience. A few ibuprofen, an appointment for next month when they have time. The problem is that a small percentage of dental infections do not stay small. They spread. They reach the airway, the bloodstream, the brain, the heart, and while it is rare, it is real. Every dentist who has been in practice long enough has either seen it themselves or heard it from a colleague. A tooth infection that became a hospital admission. A tooth infection that became a tragedy. I'm going to be careful with this conversation because I do not want to scare you. I want to inform you. Today, I am going to walk you through what actually happens when a dental infection spreads, the specific warning signs that mean you stop waiting and go to an emergency room tonight, and the everyday situations where a slow-growing infection can escape your notice for years until something gives. By the end of this video, you'll know when a toothache is a toothache and when a toothache is something else entirely. I'm Dr. Helen Bennett, 25 years in practice, the last 15 as a biomimetic and holistic dentist, focused on saving teeth and on the mouth as part of the whole body. Before we get into this, do me a small favor. Drop your city or state in the comments. I love seeing where you're watching from. And one important thing, everything I share is educational. It is absolutely not a substitute for in-person dental and medical care. If you suspect you have any of the symptoms I am about to describe, do not finish this video. Get evaluated. Here's what's at stake. A dental infection, what we call an abscess, is bacteria multiplying inside or around a tooth, usually because decay reached the nerve, or a crack let bacteria into the pulp, or gum disease created a pocket where bacteria moved in. Most of the time, the body walls off the infection. The pus collects, the swelling stays local, the tooth is treated with a root canal, or an extraction, or in some cases, with antibiotics first, and the patient recovers. That is the common course. The uncommon course, the one no one talks about because it is rare and frightening, is what happens when the infection breaks through the body's containment. The clinical downhill, when it happens, can move fast, from a localized abscess to a swelling that crosses tissue planes in the face and neck, from a swelling to involvement of the floor of the mouth, which is called Ludwig's angina, and which can compromise the airway in hours, from a localized infection to bacteria entering the bloodstream, which can land in the heart, the brain, the lungs. The systemic story has been written about in the major medical journals for decades, and the link between aggressive dental infections and awoke heart valve infections, bacterial endocarditis, is one of the better documented in medicine. None of this is theoretical. It is rare. It is also real. I don't tell you this to scare you. I tell you because no one else will, and because the small percentage of cases that go badly almost always had warning signs that were dismissed. And about halfway through, I am going to share the 4 warning signs that, if they appear together, mean you stop waiting and go to a hospital that night. Most dentists know them. Most patients have never been told them. Stay with me. Let me back up and explain what an abscess actually is. The inside of a tooth is hollow, and inside that hollow space sits the pulp, nerve, and blood vessels. When the pulp dies from infection or trauma, the bacteria inside it have nowhere to go but out through the tip of the root into the bone underneath. There, they create a small pocket of infection. The body responds with inflammation, swelling, sometimes a visible bump on the gum, often pain that throbs in time with your heartbeat when you lie down. That bump is sometimes called a fistula, and when one drains pus when you press on it, the body has actually given itself an exit valve. Patients with chronic fistulas often live with them for years because the drainage relieves the pressure. They do not realize they are walking around with an active, untreated infection that has set up housekeeping in their jawbone. Here's the truth most dentists won't sit down and tell you. A tooth infection that drains is not a tooth infection that has resolved. It is a tooth infection that has found a path of least resistance. The bacteria are still there, the bone damage is still happening, and the path of least resistance can change. If the drainage closes off, if the immune system is suppressed by stress or illness or a new medication. If the patient develops a new condition that lowers their defenses, the infection can pivot from chronic and contained to acute and spreading. That pivot is when the danger begins. Now here's the part that's going to surprise you. The patients I have seen with the most concerning infections are not always the ones with the worst pain. They are often the ones who have learned to ignore the pain because they have lived with it for years. The toothache that comes and goes, the bump on the gum that drains and reseals, the sensitivity that flares for a week and then settles down. These are not signs of a tooth that is healing. These are signs of a tooth that is fighting and losing in slow motion. The patient who comes in with sudden, severe, brand new pain often gets treated quickly because their pain demands attention. The patient with the chronic, low-grade story sometimes waits years until the body's containment fails. If you only remember one thing from this video, let it be the 4 warning signs I am about to give you. These are the signs that mean a dental infection has crossed from local to potentially systemic, and they mean you go to an emergency room, not a dental office, that night. The first is swelling that crosses your jawline, not a small lump on the gum, not a tender spot. Real swelling that is changing the shape of your face below the jaw, into the neck, or across the cheek into the eye. That is tissue plane involvement, and it is a medical situation, not a dental situation, until proven otherwise. The second is difficulty swallowing or breathing. Any sense that swallowing has become hard, that your tongue feels pushed up, that you have a hot potato voice, that you cannot lie flat without feeling like you might choke. Those are signs of involvement of the floor of the mouth or the airway, and they require an emergency department immediately. The third is fever, especially with chills, especially climbing past 101. Localized dental infections do not usually produce significant systemic fever. When fever appears, the bacteria have done more than stay local. The fourth is a rapid heartbeat, confusion, or a feeling that something is very wrong with your whole body, what older clinicians sometimes call a sense of impending doom. That can be early sepsis, and it is one of the highest priority emergencies in all of medicine. Any one of those in the context of a tooth that has been bothering you is worth being seen tonight. 2 or more of them together, you do not finish this video, you do not call the dentist's after-hours line, you go to a hospital. Let me say that better. The dental office is the right place for a toothache. The emergency room is the right place for a swelling that crosses your jawline, a swallowing or breathing problem, a fever, or a feeling that your whole body is wrong. Most dental infections are the first situation. A small percentage are the second, and that small percentage is what we are talking about today. Now, where the gap comes in. There are deeper protocols a trained biomimetic or holistic dentist can use to identify chronic low-grade infections before they become acute. Cone beam CT imaging that shows hidden bone lesions, invisible on flat x-rays, careful thermal and electric pulp testing on every tooth, evaluation of old root canals for failure, ozone treatment of borderline infections. Those require trained practitioners. I will not walk you through home versions. The value of this video is to know when to escalate, not to manage a serious infection at your kitchen sink. Let me tell you about a man I'll call Walter. 68 retired contractor, came to my office a few years ago because his wife had finally insisted. He had a small lump on his gum above an upper molar that had been draining off and on for, he estimated, somewhere between 6 and 8 years. It didn't hurt most days. He had told 2 previous dentists about it, and they had each told him it was probably fine if it wasn't bothering him. When we did 3-dimensional imaging, the bone destruction around that root was extensive. The infection had eaten away enough of the surrounding bone that we could see it as a dark cavern on the scan. Walter felt fine, by his own description. He was not fine. We treated him conservatively, addressed the chronic infection, and saved the tooth with help from an endodontist colleague. A year later, Walter told me his energy was different. His sleep was better. His chronic low-grade headaches were gone. We will never know exactly which of those changes were tied to the infection and which were not, but he is convinced it was a turning point. Walter is, unfortunately, common. Here's what 25 years in practice have taught me. The dental industry's silence on how oral health drives heart, brain, and gut disease is the part I cannot make peace with. Patients deserve to know that an untreated chronic infection in a tooth is not an isolated event. It is a slow, quiet, inflammatory process that talks to the rest of the body every day, and that occasionally, in the wrong combination of circumstances, becomes acute. The patients who pay the highest price are usually the ones who were never told this could happen. You do not need to live in fear of every toothache. Most of them are minor. Most of them are exactly what you think they are. You do need to know the small set of warning signs that mean, stop waiting, go now. And you need to know that a tooth that has been quietly bothering you for years is not a tooth that has resolved itself. It is a tooth waiting for the next conversation. Let's pull this together before I let you go. Most dental infections are local, treatable, and resolve completely with proper care. A small percentage, when warning signs are missed, can spread to involve the airway, the bloodstream, the heart, or the brain. The 4 warning signs that mean you go to an emergency room tonight, not the dentist tomorrow, are swelling that crosses your jawline, difficulty swallowing or breathing, fever especially with chills, and a rapid heartbeat or sense of being systemically unwell. A tooth that has bothered you for years, that has drained on and off, that has produced a bump on the gum that comes and goes, is not a tooth that has fixed itself. It is a tooth that needs proper imaging and an honest conversation with a dentist who will look beyond the obvious. If you have one of those teeth, do not wait for it to fail under bad circumstances. Have it evaluated calmly while you are well and treat the infection at its own pace. You are not a passive patient. You are an active participant in your own care. The dentist holds the instruments, but you hold the choice. And the choice that matters most here is recognizing the difference between a problem that can wait and a problem that cannot. In the comments, tell me, have you ever lived with a chronic gum bump or a tooth that comes and goes? And what did your dentist say about it? I read them. If this helped, hit the like button, subscribe, and share it with someone over 50 who needs to hear it. Take care of your teeth. They're irreplaceable. I'll see you in the next one.